can see a nice thin Achilles tendon attaching to the calcaneus. Here's a case of a 32-year-old male that was kind enough to let me do an ultrasound on his right Achilles tendon just to demonstrate for you normal anatomy. Also, we're going to evaluate the plantaris tendon as well in this case.
32.
32, okay, we're going to do a ultrasound on a 32-year-old male. Basically, no complaints in his right Achilles tendon. This is just to demonstrate what normal anatomy looks like. Again, when you do this, you want to have him dorsiflex so you kind of reduce any kink in the tendon or any anisotropy that may form. So we're going to go ahead and just do a long axis view initially. You can see a nice thin Achilles tendon attaching to the calcaneus.
Who are you calling that?
And here you can see the Achilles tendon attaching onto the calcaneus, a fairly linear, thin tendon which is normal. You can see the underlying Kager's fat. And we're going to travel up here. See the Kager's fat pad underlying the tendon.
Who are you calling fat?
Here's a good clip. You can see the soleus muscle merging into the distal Achilles tendon. And we're going up proximally now. And here you can see the soleus muscle, that triangular type muscle on the right side of the screen, merging into the distal Achilles tendon. You can see some veins within the soleus muscle. We're going to go down on the depth now. We're starting proximal and going distal. We can see the underlying deep compartment, most likely your flexor hallucis longus muscle. And here are the layers that are pretty nicely delineated. You've got your Achilles tendon, which is pretty thin at this point, then soleus muscle, then your deep compartment. Here we are, we're going distally again. You can see that soleus muscle stop, probably about 3 or 4 inches from the calcaneus. We're going to do some axial views now. Right side of the screen is medial. We're starting at the calcaneus. And you can see that tendon right away. And now we're going proximal. And you can see the tendon start to thin out. We're going to go down on a depth. We're going to start from a proximal view. You can see the fibula on the left side of the screen, tibia on the right. And here I believe you can make out the different muscles within the deep compartment. Just show the transition between soleus muscle and Kager's fat. Here's the Achilles soleus muscle, and then as I go distal, you can see that soleus muscle taper off, and now it's just purely Kager's fat pad as we go towards the calcaneus. We can see the medial gastrocnemius muscle with the underlying soleus muscle underneath that. Between that, he has this plantaris tendon. And we're just going to follow that distally. Starts lateral and goes medial. A nice view of the plantaris tendon above the soleus muscle. And now you can see it just transition into the Achilles tendon. And here's a nice view. You can see that very thin linear plantaris tendon merging into the distal Achilles tendon. You can see the soleus muscle underneath the plantaris tendon. And then we're going to go proximal, and we're just going to get that plantaris tendon above the soleus muscle. So that's what normal anatomy essentially looks like.